Assalamualaikum and a very good morning to everyone. Thank you for joining this morning's webinar session. I am Dr. Aida Halina binti Abdul Razak. I am a psychiatrist in Hospital Serdang. Today, I have been given the opportunity to talk about sleep disorders. Although there are many types of sleep disorders in the field of medicine, I would mainly be talking on insomnia. Reason being, not only insomnia is the most common sleep disorder, but it is also the one that is most relevant in the field of psychiatry. I hope that within this 30-minute session, whatever I'm sharing today would benefit some of you at least who's watching. There are probably going to be some terms that could be maybe complicated, but as a whole, I hope my slides are simple enough for everyone to understand. Okay, my slides are mainly in English, but my talk would be a mixture of English and Bahasa Malaysia. I hope that's all right for everyone. As we know, we all need good quality sleep for us to feel, in order for us to feel our best, maintain our healthy physical and mental health, and for us to be able to perform up to our full potential. It is not unusual for us to have disruptions to our sleep patterns at one time or another. It could be due to stress, illnesses, when we're traveling, or any other temporary disruptions to our daily routines. Like myself, yeah? I had problems sleeping last night because I was worried about my session today. But I hope that my sleep routine would be restored after this from tonight onwards. However, it is not normal to regularly have problems getting to sleep at night and to wake up feeling exhausted the day after. So before we move on to sleep problems or sleep disorder, let me share with you a bit about what a normal sleep is. Okay, a good night's sleep is when we are able to fall asleep easily, do not fully wake up at night, do not wake up too early in the morning, and able to feel refreshed during the day. The amount of sleep varies among individuals, where the young, especially babies, sleep more than the elderly. And sleep patterns are also different in different phases of life. Sleep patterns being, for example, babies, they don't have any sleep pattern. They would be awake at night, sleeping all day. But normally, by the age of 5, children tend to adopt the adult sleeping pattern, which is mainly asleep at night and awake during the day. Okay. The amount of time spent sleeping gradually decreases until the age of 80. This is a graph to explain about our normal sleep pattern, which is the circadian sleep rhythm. Sleep urge is greatest at night with a small increase at midday. Rasa nak tidur tu usually between 1 to 2 p.m. That's why a lot of us tend to take naps at midday. Sleep need increases throughout the waking hours and is replenished during sleep. So, what is sleep disorder? According to the American Psychiatric Association, sleep disorders involve problems with the quality, timing, and amount of sleep. Sleep difficulties are linked to both physical and emotional problems. Sleep problems can both contribute to or exacerbate mental health conditions and be a symptom of other mental health conditions. So what happens when we don't have enough sleep? I'm sure everyone has at a point in their life sleep problems, and I know it is not easy when we don't have a good night's sleep. As we know, sleep is vital for a good brain function. So when we don't get enough sleep, we will experience fatigue, decreased energy, irritability, and problems focusing. It could also impair our ability to make sound decisions. It would also affect our mood. Sleep problems often coexist with symptoms of depression or anxiety, where sleep problems can exacerbate depression or anxiety, and depression or anxiety can lead to sleep problems, vice versa. Yeah? Sleep disorders are linked to many chronic health problems such as heart disease and diabetes. Sleep disturbances can also be a warning sign for medical and neurological problems such as heart failure, arthritis, and Parkinson's disease. So like I mentioned, there are many types of sleep problems. Okay, insomnia, narcolepsy, you can have a read through the slide. In the Diagnostic and Statistical Manual 5, the one that we use to assess patients and make a diagnosis, the categorization of sleep-wake disorders are as follows here. Insomnia disorder, hypersomnolence disorder, narcolepsy, breathing-related sleep disorder, circadian rhythm sleep-wake disorders, parasomnias, restless leg syndrome, as well as substance or medication-induced sleep disorder. So, you think you may have sleep problems, or maybe it's just a normal disturbance to your daily routine. Try asking yourself these questions. Do you feel irritable or sleepy during the day? Have difficulty staying awake when sitting still, watching TV or reading? Easily fall asleep or feel tired when driving? Find yourself have slow reaction time? Have difficulties concentrating? Do you often get told by others that you look really tired? And find yourself that you require caffeinated or energy beverages to keep yourself going? So, if you think that you may fulfill some of the list of questions I've mentioned, maybe you need to seek medical help for your sleep problem. And prior to seek professional advice for your problem, I would really suggest that you keep a sleep diary. What is a sleep diary? It's where you put in detail every day the time that you go to bed, the time that you eventually fall asleep, and the time that you wake up in the morning. And I would also advise that you identify what activities that you do during that day, food that you take, drinks that you take, anything that you can put in detail, because these are the assessment that the doctor would want to know when you come and seek help. Okay, so a sleep diary. Okay, let me move on now to what I mentioned earlier, where my talk would revolve more on insomnia. Yeah. Okay, insomnia, by definition, is the feeling of inadequate or poor sleep because one or more of the following. Initial insomnia is trouble falling asleep. You dah masuk tidur, dah baring semua, but still cannot fall asleep. Middle insomnia is trouble maintaining sleep. You can fall asleep at the expected time you usually fall asleep, but you have problem maintaining the sleep. Yeah? It's whereby you keep waking up in the middle of the night, you fall asleep again, and then waking up again. So this is interrupted sleep. Terminal insomnia, waking up too early. You would expect to wake up around 6 or 5:30 in the morning, but you always keep waking up around 4 a.m., 3:30 a.m., but you will have difficulty. Some general information with regards to insomnia, okay? Like I mentioned earlier, it's a common disorder. It affects about 30 to 40% of the adult population and is chronic in about 10 to 15%. It is more common in women and generally increases with age. Elderly find that they have difficulty sleeping more commonly than young adults. Insomnia has been associated with reduced quality of life, mood disorders, and increased health service utilization. and 40% of people with insomnia have concurrent psychiatric disorder. As insomnia affects concentration, it is a major risk factor for accidents. Again, like I mentioned, we use DSM-5 to diagnose patients in psychiatry. Here in DSM-5, insomnia for the criteria A is defined as dissatisfaction with sleep quality or quantity with one of the associated following, one of more: difficulty initiating, maintaining, and early morning awakening, like I mentioned earlier. Maybe we can skip through this. And the insomnia is not caused by substances. Substances can be recreational substances, alcohol, smoking, drugs. It's not associated with other illnesses. Okay. People don't simply develop insomnia overnight. Okay. There are certain risk factors that may occur in a person's life that predispose that someone to develop insomnia. The conditions could be psychological stress. Psychological stress can be many things. Relationship issues, financial issues. Students may have problems with their studies, causing a lot of stress. People with chronic pain may have problems sleeping. How can you sleep when you experience pain? Heartburn. There are also certain medications that could have insomnia as a side effect, such as the ACE inhibitor, the hypertension punya ubat, cholesterol medications, as well as the treatment for retroviral diseases. Hormonal problems can also predispose you to have insomnia, such as menopausal women, as well as people with thyroid conditions. People with who works at night, night workers, travelers may have issues, may end up developing insomnia. We don't know. Okay. On top having, there are also cognitive and behavioral theories of insomnia. I will try to explain this, and I hope it is simple enough or understandable for everyone. Okay, for the cognitive model of insomnia, a person may experience stress in his or her life, and this stress causes that person to have difficulty sleeping, susah tidur. And bila susah tidur, and makes you feel stressed and frustrated. Okay, and then bila you susah tidur, you jadi lagi stress. So when this happens a few nights, you may develop a negative thought in your mind that I will never fall asleep again. Aku ni memang dah tak akan dapat tidur macam dulu lagi dah. So lagi stress. So benda ni akan berulang-ulang dan menyebabkan insomnia yang baru wujud tu akan jadi kronik, Okay. Harap boleh faham. So that's the cognitive model. There is also the behavioral model of insomnia. It's a state of conditioned arousal which may develop in which situations associated with sleep become alerting rather than relaxing and thus further impairing sleep. Apa ni? Contoh katil kita, bilik kita, environment bilik kita biasanya akan buat kita rasa tenang, boleh tidur. Orang yang ada insomnia ni, bila dia baring, dia tak boleh tidur, dia rasa resah. Dan bila tak boleh tidur, rasa resah ini berlaku berulang-ulang kali, dia akan situasi itu akan membuatkan dia rasa bilik yang sebelum ni boleh menenangkan dan katil yang best tu sebelum ni boleh dibuat senang tidur, akan in his mind dia akan associate, susah tidur. Okay. So apabila when we encounter clients who come to us with issues that they may have insomnia, how do we treat them? Okay, treatment will start with a full and detailed assessment. And like what I mentioned earlier, it would be very helpful if you come with a sleep diary, because our detailed history taking would be to identify many factors, yeah? If you have insomnia in the past, any treatments in the past, what is your complaint now? Do you have sleep problems in the past? Your general sleep schedule, factors at home, your dietary intake, any stress or any issues, okay? Any medical or psychiatric history, any medications, and any if you do take any recreational substances. And if a diagnosis of insomnia is established, as for any other medical illness, treatment would be non-pharmacological as well as pharmacological. So it would be a tailor-made treatment. Bukan semua orang sama, we will assess the patient and decide that individual whether or not it requires pharmacological treatment, or for his condition, it's okay to begin with non-pharmacological. Some patients, maybe the condition would require both. Some patients we would almost always emphasize on the non-pharmacological intervention first. The non-pharmacological intervention include treating the underlying contributor. So if you have pain, say it's a chronic pain of your shoulder, you might want to see an orthopedic specialist to sort out your shoulder pain. Okay, and then we would optimize sleep hygiene, see if there's any issues with your diet. You may have to make some lifestyle changes. There is also cognitive behavior therapy for insomnia. So, in the non-pharmacological treatment of insomnia, it focuses on teaching techniques to modify sleep disruptive behaviors and cognition that interfere with sleep. So, mungkin ada lifestyle kita yang tak sesuai untuk membantu kita tenang supaya boleh tidur. Disruptive behavior. So, kita cuba pecahkan that disruptive behavior. Or we identify your cognition, your negative thoughts that make you have difficulty sleeping. So in sleep hygiene, it aims to control the environment and behaviors that precede sleep. So there's so many things under sleep hygiene. I'm only going to share a few. And one of the important one is to keep a regular sleep-wake pattern. Go to bed around the same time every night and wake up approximately the same time every day. This is very important for people with insomnia. Make sure you exercise regularly. Make sure that the bedroom is comfortable, free from light, from noise, and then you have good temperature. Kalau rasa aircon tu sejuk, make sure the temperature is comfortable enough for you. Eat regular meals and do not go to bed hungry. Make sure that you use the bed only for sleep and sex. Do not watch Netflix. Do not play games in your bed, because those are activating activities. Try to engage in relaxing activities prior going to bed, such as reading, writing, listening to calming music, or taking a bath. So aktiviti yang relaxing ni tak apa. Yang macam saya cakap tadi, main game, tengok movie, benda-benda tu can be activating. Some people they exercise at night. Kalau dia tak ada masalah tidur, tak apa. But people with insomnia, we do not advise that you exercise at a time too near to your bedtime, because that could be activating. And we advise that you have bedtime cues. What are bedtime cues? Bedtime cues ni behavior yang dia akan signal kat otak kita oh, orang ni dah nak tidur. So otak kita akan slowly calm down. Simple things as people, they brush their teeth before bedtime, they change into their pajamas. Okay, some people put bau-bau wangi yang such as lavender oil at night to help they calm down. So these cues would help you to prepare your mind that you're going to sleep. Yeah. So those are do's. How about don'ts? Okay. Avoid drinking too much near bedtime. Yes, we need to drink lots of water during the day because it's healthy. But drinking too much water near bedtime may cause you to keep waking up to go to the toilet. So this can disrupt your sleep pattern. Yeah. Try to cut down on all caffeinated products. It's not easy. Yeah, easier said than done. So for someone yang memang coffee addict or really need coffee to function well during the day, we advise that you stop taking them about 4 to 6 hours prior your bedtime. Yeah. Try to stay away from alcohol and smoking, especially in the evenings. Try not to take your problems to bed. Again, easier said than done. You will lie down and start thinking about your problem, like me last night. It's not a problem. I was just anxious last night. Turn around your clock. Don't look at your clock, because looking at the clock may cause further frustration. It's already 1 a.m. Why am I still not sleeping? Can cause further frustration and make you not fall asleep further. Yeah. Avoid excessive daytime naps. If you do nap during daytime, try to keep them below 20 minutes. We would also advise on relaxation trainings, such as the progressive muscle relaxation, the breathing relaxation. There are also imagery training, and so on. So, if a patient has embarked on the non-pharmacological approach and still have issues, when I say embark on, meaning diligently perform whatever that's been told, do the do's and avoid the don'ts, and still they have problems, we would then help them with certain medications. Yeah. Okay. There are many types of hypnotics that that can be selected to help with sleep. Okay. For patients, of course, for patients with concurrent medical problem, concurrent medical illness, concurrent psychiatric problem, those illnesses have to be treated along with the hypnotics prescribed. Yeah. So a person with depression, we would like to treat the depression, and if still the insomnia, and if the insomnia is still an issue to the person, we would add on or start the hypnotics simultaneously along with the don'ts. Try not to take our worry to bed. Yes, maybe Alex, you have too much worry. Again, this worry has to be discussed with your therapist or whoever doctor you're seeing to see whether or not we can sort it out. Yeah, worrying can impair our sleep. Yeah. Okay. I see a lot of insomnia cases in my clinic. Some people worry, oh, can my sleep be restored? I think the main thing to note is have a realistic expectation about your sleep. Don't have a rigid thinking in your mind that, oh, to be able to function well, I will need at least 6 hours of sleep. No, please don't have such rigid thoughts in your mind, because some people just need 4 hours of sleep. Okay. Just to share, I have one patient. He has insomnia, which I help treat with hypnotics, and he had initial insomnia. Yeah? So he had problems sleeping. With the hypnotics, he was able to fall asleep, and when he comes back, he was quite happy that he has the sleep initiating part was resolved. But he was still not happy because he sleeps around 10 and he wakes up around 4. So there is what? About 6 hours of sleep. He's still not happy because he wants to sleep at least 8 hours. He wants to have at least 8 hours of sleep because that's what he thinks optimal sleep hours should be. So yeah, that was the point I was saying earlier. Just have a good enough hours of sleep that is required for us to feel refreshed the next day. We need to bear in mind that our thinking can really affect our mood, our behavior. So maybe like, yeah, yesterday I did not sleep well. So I tell myself, let's get this done and over with. And then hopefully my sleep would be okay later on. Say my sleep would not be restored tonight. I will need to always look at the brighter side. I can't sleep at night. Maybe I can utilize those time to do a bit more reading, something like that. Okay. Yeah, I hope this session has been useful. I apologize for some problems or the hospital punya pengumuman earlier. So in the end, I hope somebody has benefited a bit from my talk today. Thank you.